Welcome, everyone. We're so glad you're here for course number 1 in our Home Modifications for Better Patient Outcomes series. Before we begin, and as everybody joins us, please go ahead and open that Q&A box on the bottom portion of your Zoom screen. And this is where you can ask any questions throughout the webinar. And also, if you don't mind just putting in there right now where you're joining us from and your role. It's really fun to see the mix of clinicians that we have in the room. So again, just where you're from and your role, and it's cool to see some familiar names and faces on there as well. All right. I love it. Waiver case manager in Minnesota, in Brittany. Oh, I wish I was in Myrtle Beach, Brittany. That'd be nice. I'm in Colorado right now, Loveland, Colorado. My name is Lindsay Burmeister, and I'm filling in for Amy Reed today. Joining you from Colorado. I've spent the last 10 years in the home access space, partnering with clinical teams to help individuals of all ages and abilities maintain safety and independence at home. Before joining Lifeway 8 years ago, I worked in non-medical and skilled home care. So I've always had that mission to keep our clients safe, happy, and healthy at home. So I'll be your facilitator today. Aaron Devendorf, our favorite guy in the Denver office, will be joining us live from one of our adapted show homes to demonstrate those solutions in real time. So again, if you're just joining us, go ahead and put your name and your location and your role in the chat. And our outreach team is working behind the scenes to welcome you and to answer any questions that come up throughout the webinar. We are not able to hear you, but the best way to communicate there is just with that Q&A. So we'll start here. As the title shows, today's course focuses on empowering independence through comprehensive home modifications, and that's across the lifespan, across all ages. We've provided this course specifically for the last couple of years, and we've always asked webinar attendees for feedback. And this course right here today has been rated the most impactful time and time again. So we're really excited to bring it back to you today. Couple notes of housekeeping, because this question, I'm usually behind the scenes, this question comes up multiple times. So our new and improved CEU process, much easier than it used to be if you're joining us from a little bit of a time off from our CEU webinars. To qualify, you must attend at least 35 minutes of today's live webinar. After the session, our team at Lifeway will verify attendance and then send eligible attendees an email with instructions for next steps. So if you registered to attend, you received the email with the link that you used today to join, you're good to go. You don't have to do anything else. We'll send you that email with instructions. From there, you can either request a formal CEU certificate for $17 or a free certificate of attendance. If you are requesting that CEU, please do submit that request within 7 days of receiving that email. And then our partners in accreditation at VGM will email you the certificate approximately 2 weeks after that. Certificates of attendance, though, are available immediately after submitting your request. So that is a big change and has made it a lot more simple. I'll show this slide with all these instructions again at the end of the webinar as a reminder, so you can sit back, relax, and enjoy today's course. So let's dive in. The majority of older adults have said that they want to age in place. 4 out of 5, in fact, have said that. But falls are really one of the biggest barriers to making that happen. We know that targeted home mobility interventions do reduce falls, and that falls account for over 1/4 of hospital readmissions. So when we talk about home accessibility, we're not talking about fancy home upgrades, right? We're talking about outcomes. And that's why we're all here to discuss that today. Stairs, though, they're one of the most common and most underestimated risk factors in the home. And each year, around 1 million people, this was shocking to me when I first heard it, are treated in the ER for falls down the stairs, right? So for older adults, and I think everybody on this call has seen it, older adults often have a fall that results in a fracture, oftentimes a hip fracture, right? And it significantly changes their level of independence and their long-term outcomes. So we know, we've seen it, where they fall and they never return back home, or they fall and maybe they rehab like a champ and they get back home, but that home environment's never really the same. That family has been affected. We've got family caregivers now. If we can prevent that fall from the beginning, that's incredible, and that's our goal. So when we're talking about risk, we're not just talking about dramatic accidents, we're talking about everyday routines. So just going up and down the stairs to bed, doing your laundry, right? Coming in and out of the house from watering the plants. The basic stuff doesn't have to be major. The CDC reports that 1 in 4 adults over the age of 65 fall each year. So it's important to really see how, those early intervention steps are. So this is where small proactive adjustments can prevent major life disruptions. And that's what the course today is all about. The data here in this graph is sobering. Since the year 2000 on the left side of that graph, death rates from accidental falls have tripled in the United States. Even when we adjust for age, this isn't just because our population is getting older, the trend continues to climb. So in the year 2000, the age-adjusted death rate from falls was just under 5 per 100,000 people. And by 3 years ago, in 2023, it had reached over 11 per 100,000. So that really tells us something important. Falls are not an isolated event. They're a growing public health crisis for older adults especially. Like we mentioned before, that fall is often the tipping point that leads to hospitalization, the loss of independence, that revolving door of hospital readmission, and often long-term care placement. And again, the majority of those falls don't happen when we're out running errands and going to church and getting groceries. They happen within the 4 walls of the home. So that's where home safety and modifications come in. This should be seen as preventative health care. I could get on a soapbox all day long and talk about Medicare coverage, which we will talk about that, and funding. But these solutions that we're talking about, they help reduce risk and help people age in place with dignity. So if we can intervene early, you'll hear myself and Erin say that ad nauseum probably. We want to intervene early before the first fall, and we can change that trajectory. The opportunity really is in front of all of us. So what does this really mean for all of us? That falls are increasing, and not just because our population is aging, not just because that silver tsunami of baby boomers is coming. Even when researchers adjust for age, that death rate and fall rate has more than doubled. So it tells us that this isn't just part of aging, it's environment and risk going unaddressed. And many of you who are here on the call and our team at Lifeway, we're often the first ones to see it. And you probably see it with your clients, even with your own family members. I personally have 72-year-old parents that won't listen to a thing I say and suggest in their home, which is really fun, even though I do it for a living. But we walk into the home, right? We see it before the crisis happens. We notice those steep stairs or the bathroom that doesn't have support there, even a simple grab bar. And that client, like my dad, who says, I'm fine, but they're starting to limit where they actually live and go within their own home. I know my grandpa went from a big rambling 2-story farmhouse in Iowa to the main level. And then by, the last 6 months of his life, he basically lived in his chair, right? He didn't want to move out, but he slept in his chair. He had a bedside commode next to him. His care was delivered in that small area. Because he really didn't want to do any modifications to the home. So because our clients and just people in general, we're living alone longer, we're living longer, right? We're managing far more conditions than we were in the past, which is often leading to taking more medications. And we're staying in homes that weren't designed for longevity. So falls are preventable. That's the encouraging part. And when we address the home safety concerns early, we do promote and protect that independence. We preserve assets. And by that, I mean it's typically cheaper to stay living in the house that you already live in or own than moving out and paying for ongoing care. And often it prevents family crises and caregiver strain and burnout. Most safety concerns inside the house fall into 3 main categories. First is access to the home, even 1 or 2 steps at the entry, or even heck, a couple of inches from that patio into the house can completely change discharge plans or options for longevity in the house. The second area is level changes. Stairs inside the home are one of the biggest fall risks, like we talked about before, especially when balance is compromised or endurance is decreased, or we're dealing with the hot summer months and we're dizzy and dehydrated. That's all a giant risk. And then third, we've heard it, we've told our clients about it, told our families about it, the bathroom, right? This is where the majority of injuries happen, whether someone's stepping over the tub walls, engaging in unsafe transfers. They don't even have a grab bar, right? We want to make sure that that bathroom is set up. As I'm sure Erin will point out when we get to the adapted show home, bathrooms are one of the smallest rooms in the house, and they have the hardest and sharpest edges, and your body and your feet are typically wet when you're in there. So not a good combination. So when we're working with families and with clients and we're talking about a home consultation, anytime that we can, just like with any goal, we can break it down into manageable parts, in this case, 3 main categories in the home to look at and assess for safety. It really simplifies what can otherwise feel like a daunting and overwhelming quest for clients and their families, and it kind of gives them a roadmap for safety options in the home. So speaking of home consultations, really the purpose is simple. We're assessing the house for 2 things, accessibility and safety. And when I say accessibility, it's can the client move through their home? And safety is, can they move without risk? So a consultation is not about selling equipment, it's about identifying those environmental barriers before they become a crisis. And often it's small modifications, little tricks of the trade that Aaron will share with us as well throughout his portion of the webinar that make the biggest difference in preserving that independence. What you're looking for over here on the right side of your screen is a copy of our home accessibility review. I don't know why I have a hard time saying that, but during a consultation, again, we're identifying those barriers and recommending solutions that are going to align with the goal of aging in place, right? Or if you're a clinician and a therapist and you're getting ready to get somebody home from rehab, that align with your goals for that patient as well. So overall, we want safety, function, and, if applicable, being ready for the discharge process. So before we kick it over to Erin and Cassie in the showroom, let me just briefly share who we are and how we support you because you're here. Lifeway Mobility is a home accessibility company, but more importantly, our team likes to see ourselves as an extension of your care team, not just a vendor. And what I mean by that is oftentimes the rehab centers are not able to go out and do a home eval, right? The insurance doesn't cover it. It's not productive time. So we want to be those eyes and the ears, taking your clinical recommendations and assessing what you guys want in the house, which is versus what is feasible in the house based on our expertise. The biggest part of this, though, is knowing that you guys are involved with the care, right? So often, things are busy and families are busy, and a recommendation is made. Call Lifeway. We will show you a form later on at the end of the presentation that you can fill out really briefly to just do that nice handoff to ensure that your client gets the call from our team. We can answer their questions and hopefully set up that consultation, and we can do it quickly because our goal is to provide that home consultation, which is 100% for free, always has been, always will be. We want to do that within 24 to 48 hours. It's not always feasible, it's a goal. But again, if we know that they're in a rehab or a hospital, we know that time's ticking. And so let us know that you're involved in the care, and we'll see if we can finagle things and get our team out there sooner. Once they make a decision, professional installation is completed by our team. Our goal is 7 days or less, which helps reduce delays and then supports the continuity of care. Erin will talk a little bit about some custom features and options that are not always available within 7 days, but that is our goal. Overall, we aim to work together with therapists, care teams, social workers, everybody. And we're licensed, insured, and highly rated. We just celebrated as a company hitting 10,000 reviews with an average of 4.8 stars out of 5. So clearly something's going right, right? They are the team to trust, and we celebrate that. Our goal is simple as a home access provider. We want to ensure that the home environment's aligned with that plan of care that you've already established. So with all of that foundation, background, why we're here, etc., again, I'm going to kick it over to Erin and Cassie in the show home, but please make sure that if you have questions, you put them in the Q&A box, and then our team will work behind the scenes to answer those, or have Erin or myself answer them live. So we're going to kick it over to Erin and Cassie. Erin, are you there? He's there, but I can't hear him. There he is.
Yeah, we're standing outside here. A lovely day in Denver, Colorado, at one of the world's greatest adapted show homes, if I do say so myself. And earlier, you had kind of talked about those places in and around the home that we really want to focus on. And my portion today is really going to emphasize those solutions that deal with those three main barriers we have in and around the home. That's going to be that exterior egress, getting in and out there, levels in the home, and then some bathroom tips and tricks to keep us all safe as we try to age in place, or we're dealing with some of those mobility challenges that come along, sadly for most of us, eventually. So here I am standing in front of a aluminum ramp. You'll notice right behind me, this long aluminum ramp. And so first subject, getting in and out of the house seems trivial to a lot of us in our day-to-day as we grab our keys, we grab a banana, and we head our way out to work. We oftentimes aren't even thinking about getting in and out of the house. But if you took a moment to take a look at the front of your house or at any of the entrances, you might notice that you almost always are going to have a step or two or more to overcome in order to get in and out of the house. And this is going to become a real challenge for somebody who's maybe ambulating for the first time with a walker, or perhaps in a wheelchair. Maybe they're getting out of rehab, or maybe they're just trying to plan on how they're going to deal with this situation in the future as they age in place at home. And one of the best solutions available right now for getting in and out of the house safely is a ramp system. Now, we're quite fond of these modular aluminum ramp systems for a number of reasons. These modular aluminum ramps can be warehoused for a very rapid installation if necessary, but they're also fairly weatherproof. So there's not a lot of maintenance that you have to do on these modular aluminum ramps. The majority of them are going to come with really strong warranties, lifetime warranties. And then almost all of these modular aluminum ramps can hold 1,000 pounds of weight in any one section of the ramp, which is it's just huge. I mean, that means that if we are planning on aging in place, we know that as well as any kind of mobility equipment, I might on this ramp safely. Now, when I'm doing a home evaluation, and I do a number of them, and I'm looking at getting in and out of the house and trying to design a ramp, I'm able to use my modular aluminum ramp material to design a configuration that adapts in and around obstacles like trees or shrubs, things like that. These these modular ramps, they come in different length of sections with different size platforms, and I can use those different lengths and different platforms to design a ramp that might be able to do a switchback, maybe a 90-degree turn. And so why I need that flexibility is because the most important thing when it comes to a ramp is the slope, or how steep that ramp is. You can imagine that it's much easier to ambulate in a wheelchair on a shallow slope than a very steep slope. And I'm going to illustrate that here in just a moment. The slope calculation is kind of fun. It's basically for every inch in rise, you need a foot of sloped ramp material. That's right. So it's called a 1:12 ratio. For every inch in rise, 12 inches are required to safely ambulate up a slope. Now, what we've got set up here is a 16-inch tall platform, and on one side we've got 16 feet of ramp material. On the other side of that, we have half the ADA recommendation, or 8 feet of ramp material. And I am going to be a daredevil today, and I'm going to ride up both sides in a wheelchair. Lindsay, you'll enjoy this, and I'm going to describe the feelings that I'm getting as I'm doing that. Now, a couple things you'll notice as we walk that way are these handrails. Now, all these modular aluminum ramps are going to come with these double handrails. And this is so important that we don't just have a top handrail or no handrail at all. We want this double handrail so that there's no risk of myself and maybe my wheelchair of sliding underneath this top rail and maybe trapping my neck as we're rolling off of a ramp. In order to also prevent sort of that roll off are these kick plates that you'll see at the bottom of the ramp. Now, a lot of times, a client or a person, they might have like Uncle Bob build them a ramp, and we love Uncle Bob. But what Uncle Bob often neglects to do is consider things like these kick plates or like this additional secondary handrail to prevent us from rolling off the ramp and hurting ourselves that way. You'll also notice that these modular aluminum ramps, if we get up really close, they're textured. And this texture really helps for a nice clean grip as we're ambulating up and down the ramp. Now, having this handrail on both sides of my ramp is just phenomenal because I am able to get a nice firm handhold as I ambulate up and down. But at 3 feet wide internally, we have big enough space to ambulate using perhaps a walker or really any type of wheelchair out there. And so why don't we do that demonstration now? I think it's kind of fun. And what I'm going to do is I'm going to get in this manual wheelchair. This is just a standard manual wheelchair. And what I'm going to do is I'm going to actually physically try and roll up the steep side of this ramp. And again, this is 8 feet of ramp going up to a platform that is positioned 16 inches off the ground. So I'm double that I try and ambulate in a wheelchair. And that if I lean back in my chair and I'm struggling to sit forward to keep my weight forward, and there's a ton of pressure pulling, it wants to drag me backward and down. It's hard on my core. I made it, thank goodness. It's only 90 degrees today, and I'll tell you what, that took everything out of me just to get up that very steep ramp. You know, it's great I'm able to do that, but so many people are not going to be able to do what I just did there, which is roll up the steep slope of a ramp that is double the slope recommended by the ADA. So that is definitely something we have to look at. That's definitely something I'm evaluating each and every time. And it's not about my comfort necessarily as the user. Maybe it's about the comfort of my house or
Going to interrupt you really quick. We are communicating.
on a ramp that's super steep. So another important aspect to ramps isn't just the up, but also the down. And when I try and go down the steep side of this ramp, the first thing I notice is that, again, that pressure is tremendous trying to pull me down the ramp. Also, if I just roll just a little bit and stop, even with the gradient texture on the ramp, I am sliding down the ramp. I'm not actually stopping. It's a very intense feeling trying to come down that ramp. So now what we'll do is I'm going to roll down this way across the whole ramp structure, and I'm going to go up and down a true ADA sloped ramp that meets the 1:12 ratio. And I'm going to go right up this side, which again is 16 feet long, up 16 inches of ramp. And on the up, first thing I notice is my back is very comfortable in the backrest, the seat of the wheelchair. So on the backrest of my wheelchair, I am sitting fully back, very comfortable. I'm not my core is loose. I'm not straining to do this. I can stop when I want to, and I can just kind of hold myself in place. The feeling of the wheelchair, the wheels, the grips on the side of the wheels, uh, when I'm coming up that steep portion, it feels like they're pulling out of my hands. It's a very uncomfortable feeling and very intimidating that way. And then on the down, on this true ADA slope ramp, I can stop and I don't slide. So I can really decide the tempo of my descent, and it feels comfortable. I really just have to put a little pressure on my little grab bars here on the side of my wheels, just to keep myself from descending. And it's just very clear as I'm doing this that if I were having mobility challenges, I would think long and hard if I had a really steep ramp I had to ambulate to go outside and sit in my garden or go see my neighbor or go collect my mail. What a properly sloped ramp does is it gives a real sense of independence, freedom, because you're actually going to use it without the dread that you could get injured trying to use the ramp. Now, one thing we hear a lot about is that, you know, a foot of ramp for every inch in rise could mean a ton of ramp material for some entrances. I know some houses around here in the Denver metro area might have 4, 5, even 6 steps to get in from, say, the garage floor level into the main floor of the house. And if you have 5 steps, that could easily start to get to 35 inches of total rise, which would necessitate a 35-foot ramp. And there's so many houses here in the Denver metro area where 35 feet of ramp, even professionally configured, is just going to take so much space. We might be giving up things like parking spaces in the garage, and we don't want to do that necessarily. So that's when we start looking at other equipment like a vertical platform lift, which is right behind me here. Let's take a look. A vertical platform lift is very much what its namesake is. It's a lift that goes vertically up and down, and these lifts are going to be complete with a platform. Typically, the platform is going to be 3 feet wide internally by at least 4 feet deep internally. So you're able to roll into this platform. You can close this gate behind us, and then by just simply depressing a switch here on the wall of the platform lift, it's taking me down straight vertically. So now I can handle 35 inches without needing the 35-foot ramp, utilizing a platform lift, which is going to have a much smaller footprint. Now, just about every vertical platform lift on the market is going to have the ability to include this ramp here. And when I lift this platform lift up, you'll notice that that ramp actually folds up and blocks this side of the platform from a wheelchair rolling off the platform. The other thing this ramp allows us to do is install a vertical platform lift without having to mess with a garage foundation at all. We don't have to create a pit and recess the lift into the floor. Instead, the typical 3-inch height of the platform from the floor is dealt with by this fold down ramp, which again serves a secondary purpose of blocking our exit at the lower level. So I can roll in, up I go, and this ramp is just going to fold up behind me. Now, these platform lifts do have typically a battery primary. Those batteries are charged all the time. You just leave the lift plugged in. And then if your power goes out, you still have several trips on the lift that you can do just on battery power alone. So much like a ramp, it's there when you need it, pretty much anytime you do need it. Now, your average ramp is going to range in cost from $3,500 to $6,500. A typical platform lift is going to generally be priced in $12,000 to $16,000 range. Now, the price point of a vertical platform lift really starts to look attractive when you get that much longer ramp. A ramp that needs to ascend 6 or 7 steps into a house is going to start to have a price point that is very comparable to a vertical platform lift. And it will take up far less space. So generally speaking, platform lifts become more and more attractive the higher we need to go as it relates to what you might need with a ramp. And so both of these solutions, a vertical platform lift or a ramp, may be exactly what you're looking for when you're coming home from rehab, or if you're attempting to plan out aging in place at home. And someone like me, a home access specialist, can come out. We can kind of configure what a ramp would look like. We can configure how we would utilize a vertical platform lift. And we can figure out what might work best for that patient, that person in that home. And a lot of these things work a lot better when we really evaluate the individual who's going to be using this stuff in the space where it's going to be used. And with that, I want to head inside and look at a couple more for not getting in. Also, now we're going to focus on welcome you to our adapted show home. My gosh, it's a lot cooler in here, which we just absolutely love that. Now, inside of our adapted show home, we've got a number of different lifts set up, primarily stair lifts. And I want to draw your attention to a stair lift because this may actually be the other way that we get in to the house utilizing different level, different heights, trying to ambulate into the house. Sometimes a ramp just isn't the right thing. Maybe it's just too many stairs in a garage. There's just not enough space to configure a ramp. And maybe, a vertical platform lift is just, it's more than a person might need. Maybe they're ambulating using a cane, or they're just a little bit slower on their feet, but they don't really need the entirety of that platform. Well, a stair lift can be utilized both in a garage and in outdoor spaces, which will typically carry a smaller price point, but just offer a safe alternative to ambulate up and down outdoor stairs. So you certainly could look at stair lifts for that reason, and most commonly, stair lifts are going to be used inside the home to deal with those different levels in the home. And one of our favorites is going to be a Bruno stair lift. There's many different brands of stair lifts, but there's a few things, whether it's a Bruno stair lift or a Harmar stair lift or one of the numerous other brands, that are going to be true among almost all stair lifts. The first of which is that there's going to be some type of rail system. With a stair lift, you will have a rail that is mounted to the stair treads. This is an important point. You'll notice that the rail itself has these foot plates that are screwed down into the stair tread. Nothing has to attach to the wall or banister. So all that weight is all carried on the stair tread, which is where weight should be carried on stairs in the first place. It also means there's no construction. A team is able to bring the stair lift out and install it right to the stairs using the equipment that comes with the stair lift. There's no extra contractor to hire in order to make the site ready for that installation. Every stair lift on top of this rail is going to utilize what they call a chassis. This chassis is what actually has a motor and a drive mechanism within it, and that's going to drive up and down the rail, carrying the seat. So that chassis is going to drive up that rail and carry this seat. Now, so many stair lifts, your basic stair lifts, are going to start at a capacity of around 300 pounds. And they're going to travel in the neighborhood of 15 to 20 feet per minute up a staircase. Generally speaking, In a standard set of straight stairs, you're going to have 12 to 15 stairs, and that travel time is going to range in time between 40 to 55 seconds, somewhere in that ballpark usually. Now, these stair lifts are typically going to be operated by controls on the armrests themselves. On this particular one, I'm just holding the paddle switch, the direction I want to travel. This might also be a different type of toggle, but just about every stair lift is also going to include 2 remote controls so that you can operate the stair lift from the bottom or the top of the stairs. This presents the opportunity for most stair lifts to serve also as a dumbwaiter in the home. You can set things on the chair and use a remote to send that stuff up and down. Straight stair lifts are going to have the ability to rotate. This particular one has a motor, which is actually swiveling the chair for me. All stair lifts are going to swivel. Some have the option of a motor to do that for you, and that puts you in the direction of exiting right onto a landing. Instead of having to sidestep off of the lift, you can simply rotate the chair and exit directly onto your landing. Now, the other thing that almost all stair lifts do, almost all, be hard to find some that don't, is they fold up. And what I mean by fold up is I mean that the armrests, the seat, and the footrests are going to fold up and get really close to the wall or banister. Generally speaking, you're going to be within about 12 to 16 inches from a wall or banister to the edge of the folded seat, which gives you about 2/3 of a little over half of your stair tread to ambulate past the seat and down the stairs. So often you might hear that somebody is resistant to installing a stair lift because they're afraid it's going to take up too much of their staircase. In the case of most stair lifts, however, we can fold that up. Everybody else in the house is free to walk up and down the stairs as they need. Now, what I just showed there was what we call and refer to as a straight stair lift utilizing a straight rail. These rails are actually cut to fit the length of staircase that we have. Now, not all staircases are straight. Many are, but not all, certainly. In that case, we might look at installing what they would call a curved stair lift. Curved stair lifts are just that. They're actually built to take the user around a bend. So you might have, say, 7 stairs from your main floor to a landing. From that landing, you might make a 90 or 180-degree curve to continue up to your second floor. In those cases, instead of installing 2 straight stair lifts that would require the user to dismount one seat and get onto another seat in the middle of the staircase, instead, we're going to have one rail system that takes us all the way around the bend, all the way from the bottom to the top, or from the top to the bottom, whichever direction you're traveling. And as you can see, it's actually taking me around the corner here. And it's going to park me right at the bottom. Now, straight stair lifts are great because we can warehouse these lifts. Straight stair lifts, we just simply cut the track to fit the stairs you have, which means that an installation time can be done within just a couple of days. And as Lindsay noted, we're really shooting to be installing within 7 days of you making the decision to purchase one of those stair lifts. Now, curved stair lifts can be a little bit different. There are what is called modular curved stair lifts. Modular curved stair lifts use parts and pieces that can be put together to create the bend required. But a vast majority of curved stair lifts are going to be custom made so that they fit as tightly to the staircase as possible to make those tight turns. A custom ordered curved stair lift typically is going to have a lead time of anywhere between 4 to 6 weeks once the custom photos are taken down your stairs so that the manufacturer can build that rail to meet all the specifications of your particular stairs. Very custom thing. So a curved stair lift typically generally is going to have a little bit higher price point than a straight stair lift, where a straight stair lift is going to average around $4,000 to $5,000, depending on options. Your typical curved stair lift is going to average between $15,000 and $20,000, depending on the type of stairs you have, the number of bends the stair lift has to traverse. But oftentimes, stair lifts are much more affordable and attainable than other types of lift systems you could have in the home. Not to say that other lift systems may not be the right thing, which brings me to our next segment, which is residential elevators. Now, residential elevators come in different forms and they have certainly different capabilities. But generally speaking, you're going to have two main types of residential elevators. You'll have something like this, which I'm standing next to, it's called a Pollock elevator. This elevator is designed to go from one floor to the next or two stops, but can accommodate a wheelchair. It's one thing you might have noticed with the stair lifts is that we just have a seat that is riding up and down. If we have a wheelchair, we may not be able to use the stair lift as effectively as if we maybe are just ambulating a little softly. Maybe we're using something like a walker or a cane. So with a residential elevator, you're able to open that up and roll right in with a wheelchair. Now, if you need to go more than two stops or you need a little bit bigger capacity, a more traditional elevator might be where it's at. Now, this particular elevator is a little bit under construction, but what it looks like is just buttons next to a typical interior door of your house. A traditional residential elevator will involve a pretty heavy construction component as well as the equipment component. But these residential elevators can go up to 5 floors and they can be up to 15 square feet internally. So if you have a complicated house that maybe has tons of different levels, maybe you're in a complicated power wheelchair and you need something that can handle that weight capacity and that travel distance, a more traditional residential elevator might be exactly what you're looking for. Now, elevators like these are typically going to have equipment prices of anywhere from $35,000 to $65,000 in general, although it can go up from there for certain specialty elevators. And then you're going to have construction costs, which can range in the low 20s to high 80s in terms of $80,000 in order to construct hoistway or floor penetrations. It'll oftentimes include intense permitting, engineering, and all these things need to be figured out in order to install this equipment. So your average elevator job is going to start in the mid 50s, generally speaking. It's probably going to average more around $70,000 or $75,000. And it's not impossible to spend over $100,000 on a residential elevator. So certainly something to keep in mind as we're planning to age in place. An elevator might be one of those things that you want to get way ahead of before you actually need something. That's what's so great about stair lifts. Oftentimes a straight stair lift we can just install right when we need it. Now, moving from lift systems, levels in the home, I want to talk a little bit about bathroom safety. We're running against the clock here. I only have about 10 minutes left, but I would be quite remorseful if I didn't mention grab bars. One of the easiest things you can do to make your home safer or one of your patients' homes safer is to install grab bars. Now, we've all seen grab bars. You see them in almost every public restroom, but so many houses do not have anything safe to grab onto. You might have a towel rack or you might have a toilet paper holder. That might have already been loosened from the wall from years of using it slightly to hold on to, but it's definitely a pain point when you're using that to hold your body weight and it rips off the wall. There's numerous different colors of grab bars, but what I really want to point out are what we would call integrated or dual use grab bars. See, it might look like this is just a towel holder to the untrained eye, but to someone like me, I'll know right away that this is in fact a grab bar capable of holding 300 pounds or more of a person's full weight trying to pull down on that, which is much more effective than just your typical towel holder. Also, in this shower example here, we've got another grab bar, which looks like it's just a shelf, maybe to hold shampoo, conditioner, or a body wash. But in fact, this shelf here is itself a grab bar. I can hold on to my towel grab bar here. I can hold on to my shampoo holder. And as I step into the shower, I can maintain 3 points of contact as I'm stepping into the shower. This configuration where you have 2 grab bars to hold on to as you enter and exit the shower, if everybody had this and used this configuration, 2 grab bars to hold on to, we would see an enormous decrease in trips and falls inside the bathroom. So often people are falling, attempting to exit or enter their shower. It's extremely common, and I wouldn't be surprised if nearly everybody on this webinar has seen something similar to that take place. Why these integrated grab bars are so great is because you don't have to feel like you're bathing in a hospital room. Instead, it feels like you're just at home, and you've got these very attractive dual use grab bars to utilize to step in and out of your shower and maintain sort of that safe posture, as we've got plenty of points of contact to keep us solidly in an upright and safe position as we're getting in and out of that shower. The other thing I like to point out is what we call a super pole. Super pole is a freestanding grab bar. And it's incredible. So often people think, well, I don't have a wall near my favorite seat in the house. I don't have a wall next to my favorite seat at the dining table, but you don't necessarily need a wall. We've got this one displayed very commonly by your bed, maybe in your bedroom, you don't have a wall, where we can install a grab bar. But the awesome thing about the Super Pole is it's got this floor to ceiling tension, and it utilizes this ratchet sidebar, this advantage rail, where I'm actually able to grab onto this and utilize that as I get up, and it ratchets around, locks in place, and I'm able to use an actual grab bar in a free floating space that doesn't have any kind of wall nearby. Got about 5 minutes left, and with that 5 minutes, I'm going to show you one last thing. Now, a lot of what we talked about ranges in cost and complexity to install, from something fairly simple like a straight stair lift or a modular ramp to maybe something a little bit more complicated like a residential elevator. But one thing I really like to point out especially on these webinars, is just access into the bathroom. It's very common to have a bathroom door that's only 22 inches wide or so, and you're trying to get your walker into the bathroom. And as you try to get the walker into the bathroom, as you swing your door open, you notice that while there's enough space in the door frame, the daggone door is hanging over the door frame, and it's blocking only by about an inch my ability to get my walker or my wheelchair into the darn bathroom. Well, I just love these swing clear hinges. If you notice these hinges on this door, and if you're able to take that camera cast and get right up close to that, that actually, installing these hinges, which is like $90, you put these hinges on the door, this allows the door to swing open and be flush with the door frame, so you get your full door width. You can do things like widening a doorway. That's always great. You could do things like installing a pocket door. Like we have on this door here, we've got a pocket door that slides in, or something like a barn door, to be sure. You can install all these things, but those things are going to require a little bit more time and effort. And I know with my own dad going through medical issues, one of the things is like, well, he's coming home now and we need to figure this out now. We need a solution right now that's easy. It doesn't, it's not complicated. These swing clear hinges, everybody should know about. You buy these your local Lowe's. These install very quickly, just right where you already have hinges installed. And by gosh, you've got full door clearance into your bathroom. And with that, I'm going to stay on and answer any questions that might have come up during this presentation. But I'm going to throw it back to Lindsay. I know she has a number of things she wants to do to wrap it up. And I thank you so much for being on today's webinar.
Aaron, you are a wealth of information. One question, you're not off the hook yet, was the timeline. We talked about timing a lot. how long does it usually take to order a vertical platform lift? What's that from the minute they say, Erin, I want to move forward? What's that timeline typically like?
That's such a great question, Lindsay. And for so many of the entrances that we commonly see, the platform lift really can be installed without much customization. So what I mean by that is a typical platform lift can raise from about an inch to up to 53 inches, which means that a lot of offices like ours, but many others across the country can warehouse platform lifts. So we can have them in stock and ready to install right away. If the platform lift is in stock and it meets one of the standard lifting heights, then a platform lift can be installed within that 7-day goal. It's very possible that that could happen. Now, if you've got a little taller lifting height, or maybe a configuration that requires that we order things like 90-degree platforms or some non-standard platforms, generally speaking, you're looking at something like a lead time of 3 to 6 weeks from the manufacturer, depending on that custom part that you might need. But in general, if you just have a standard lifting height, again, oftentimes, Lindsay, we can meet that 7-day window to install.
Excellent. I'm leading the witness here a little bit, Erin, but would you say that it's super important to get a home access specialist involved very early in case you have a special order? Wink, wink.
Right. No, I mean that's a great point, Lindsay. I mean, the really when you know that you're in a situation where you've got a loved one coming home or a patient needs to start preparing, maybe a family needs to start preparing for a return from somewhere like a rehab, home assessments are phenomenal because what they can do is they can identify a lot of the very common issues. You know, there's certainly things we see all the time that are, they're very boilerplate, very standard. We've got solutions ready to go. But, you know, in general, all of us are going to have one or two things that are a little bit different than the normal. I know a lot of the things I do are a little bit different than the normal. And I think by having that home access specialist out to the home early, we can start identifying some of those things and maybe get those things on order now rather than waiting till, oh my gosh, Karen's coming home tomorrow or whatever. And
Yeah,
now we're in that situation. So
for sure.
certainly that's true.
Yeah, and we see that. Tess had a question I can help out with, so you can grab some water if you want. We've worked you to death over there. She asked if the chair rail lifts can transfer from home to home if somebody moves or if somebody rents. Do you want to take that, or should I just say a simple "of course"?
Well, Lindsay, I just love the subject so much. I'd love to just talk about it a little bit. Now, with these stair lifts, what's so cool about straight stair lifts is that oftentimes you might just need to take away a little bit of rail or add a little bit of rail, and we can move that from one straight staircase to another. So if we have a situation where we're moving houses, it can be very valuable to take your stair lift with you because it could be reinstalled on another staircase. Now, in the case of something more custom, like a custom curved stair lift, you may have some challenges trying to transfer that lift from one house to another. More often, almost always, let's say it's impossible to do since the rail is custom made for a specific staircase. So I would say you're certainly in luck with any straight stair lift because those can certainly transfer. So hopefully that helps to answer that question.
That's perfect, Erin. Stand by. We're going to cover the last few slides. And then if anybody has questions, I know our team is working behind the scenes to answer those questions. But if you just have not had enough of Aaron Devendorf, stay on. He's going to make himself available. Aaron, I wish we had you in every single office. If a family walks into the Denver show home, they're going to be treated very well. And I think it's really cool that you can show all of the options, step back, and really let them make the decision. So kudos. We're glad to have you.
Amen, Lindsay. Thanks so much. Appreciate it.
Of course, thank you. Go back to sharing my screen. With all of the expertise that Erin just shared, we're going to jump into a very quick case study. I'm very cognizant of the time, and I want to make sure you guys are able to get on with your days in approximately 6 minutes. And so I grew up in the 80s watching Saturday morning cartoons, and there was the Micro Machines commercials. And I'm going to probably sound a little bit like that Micro Machines spokesperson. So very quickly, this case study shows how a single stair lift significantly improved accessibilities for a group of non-related residents in a 6-unit condominium in Maryland. Bill, pictured here, is retired Army colonel, and he realized that a lot of his tenants were facing mobility challenges and struggling to navigate the stairs within that condominium complex safely. An elevator was not an option. It wasn't in existence. It couldn't fit into the space. And so Bill knew that, he potentially could have some falls for residents, or even have some of them have to move out and seek other housing because of the stairs. So he reached out to our Lifeway mobility team in Maryland and had a full team come and help him find a solution. And what they found was a custom curved stair lift, which provided a very safe, practical, and cost-effective, as Aaron was talking about, method for all 6 families to be able to move freely within the building. So you can see it here in action. I think I stopped sharing. Hold on. My box went away here. Share my screen. There we go. You can see it here. Beautiful right here. The curved stair lift. We actually worked to meet with fire and city permitting requirements. Aaron had mentioned, and you might have been able to hear the beep when you heard him using the stair lift. That beep will signal that you've gotten to a park position, that part around the corner, what moves the lift out of the way. We certainly never want something to be in place for safety and then be a tripping hazard. So we, before leaving, made sure to provide all the residents proper training on how to use the stair lift, provided those extra remotes that Aaron was talking about, so the lift could be called to their specific door and their location, and then scheduled ongoing maintenance. That is the biggest thing that's often overlooked. We want to make sure that we're keeping this equipment up and maintained. So from start to finish, this particular project ended up taking about 4 months. But in the end, none of those 6 families needed to move out. They were able to stay safe in their homes. So again, I told you I'd be saying this ad nauseum. The key really is identifying the need and putting a solution in place before there's a crisis. So as we close today, let's come back to the big picture. Falls are increasing, but they are preventable, and that's the best news about today. The highest risk areas in the home are predictable, and we've discussed them here. Stairs, level changes, entrances and exits, and really those bathrooms, exactly all that Aaron reviewed with us. And the solutions can be simple, like grab bars and the swing clear hinges, or more involved, like ramps and stair lifts, bathroom remodels. But the key isn't just the solution, it is the timing. And so as clinicians, you are often really the boots on the ground, the first in the home to notice those warning signs. And if you can recognize the risk and start that conversation, boy, oh boy, it's awesome when you connect clients to trusted members of our team, like our home access professionals, before a fall happens. Overall, we just want to thank you guys for all that you do to make aging in place possible. I've seen in the chat multiple questions about funding. It is usually the first concern that folks have. As many of you know, Medicare, so Medicare, we're not talking about Medicaid. Medicare sees all the solutions that we've covered today as home improvements and does not cover the cost of the equipment. And secondary insurance companies follow Medicare's lead. We did have, I believe, Janet, I might have misremembered your name, but Janet had some resources that she's going to share with us, because there are some supplemental Medicare programs that will say that they'll cover some of the cost of these. I've never seen it happen in 27 years of Lifeway being in existence, accessible systems before that. But there are some funding programs and pathways that can help. So we do have resources listed on our website. We'll help look into state and local programs. Veterans benefits are numerous and very helpful. There are nonprofit grants, and then there's monthly payments or financing options to explore as well. Overall, you've got, you're in the driver's seat, right? So if you see a patient who's, got some mobility risks, or you, are worried about them going back home or staying safe at home, really, truly just get in touch with our team. That is very, very simple. You can scan here, you can visit lifewaymobility.com, you can request information. But the really cool option here is when you scan right here, you're directed to that form that I talked about earlier today that connects you immediately with our client care coordination team. And the goal is to have a good conversation, answer some basic questions, and then get a home access specialist like Erin out to the home to assess. And then again, when you complete this form, we know exactly who's involved with the care, and then we can keep in communication. So we can let you know when the home safety consultation is scheduled. We can circle back with you after the consult happened and share the solutions that were discussed, and then moving forward, talk about the solutions and the timing so we can stay connected with our discharge plan. Hopefully some of these faces look familiar. This is our outreach team that I've been bragging up. They've been behind the scenes and they work all over the country. So we each have our area listed underneath our names, but if you do not see someone in your area, simply reach out and we can drop by with additional resources. We're happy to provide educational presentations like this to your team in person or virtually. But our goal is really to make it as easy as possible to connect your patients and clients when the need arises. We are located all over the United States. This is our most updated map. If a state is blue, we serve most of it, if not all. The white circles in there signify a branch location, and the green signifies either a location that just opened or is expected to open in the next 6 to 12 months. If you haven't had enough of us today, we have 2 more opportunities rounding out the year. We're doing these presentations again in October with a different topic, reducing readmissions, on Wednesday, October 28th. And then in December, the ethics and safety webinar will take place on Wednesday, December 16th, which is incredible. So if today's session was valuable for you and what you're doing, we hope that you'll join us for the last 2 courses. You can either scan this QR code or simply go to our website, lifewaymobility.com/upcoming-webinars. Our team loves to provide these webinars. If you can't tell, we're a little passionate and excited about what we do. If you joined us a little bit late and you're still going, how the heck am I going to be getting our CEU? This is the step-by-step. So if you're here, you had a link, you will receive an email. And then at that point, you can request a formal CEU certificate. That's $17. That covers the cost that we pay for that certification and the course. And if you just want a certificate of attendance, that'll come to you immediately once you request it. I do see more questions about local reps. Again, if you don't see your area listed underneath a name here, we are covering multiple areas as a team, and we're happy and excited to share and educate and spread the word. So that wraps up our portion here today. I'm going to stop my screen share, and Erin is still in the showroom if anyone has questions. I don't see any right now, but I know as soon as I start to shut that down, Erin, somebody will go, oh, wait. See? Oh, Mary says thank you.
Mary.
Perfect. And if the team or if our outreach team has fielded any questions that need to be dove into a little bit deeper, speak up, unmute yourself, and let us know. Give that a couple of minutes. Tess said, do you welcome our staff joining at the evaluation? Tess, I could give you a hug. If we could attend every single home safety consult that your team does, Erin would stand by and listen to your clinical recommendations and then speak up. And man, oh man, Erin, maybe you can talk to how much reduction in back and forth that can save with clinicians.
I mean, I think anytime we can work with the clinician, anytime we can work with family that might, have a really strong voice in that patient coming home or recovering, anybody who is sort of key in that person's recovery and transition back home, having them available and at the appointment is so profoundly valuable. So yes, we welcome caregivers for sure to be there, additional family members, anybody who can give us insight into the prognosis of this person, their preferences, also all those things, who can advocate truly for that person. And that's something that we talk a lot about in our ethics webinar as well. But certainly we would love to have you there. I would welcome you there by my side.
Excellent. Excellent. And then really quick, it's just a question that was asked, I think, on the last webinar. I don't know if we got to it, but talk a little bit about the training that our technicians provide to the clients when the equipment's fully installed and they're getting ready to get their signatures and head out the door.
Yeah, certainly. Our technicians are trained not only to do the equipment installation well, but our industry and this business in particular is very, people oriented, and so many of our clients get a lot of value right at the end of the installation when the equipment's in. We take a considerable amount of time to make sure that there's a transfer of understanding of how to use that equipment. So we'll have the user, for instance, get on a stair lift, try the different controls, the control on the armrest, try using the remote control. What does it feel like to get on and off the chair? What are we doing? What is the best practice of using that equipment? This is something that our technicians go above and beyond to do for those people. And so I think that's really important. Certainly, we're not afraid to go back to the home as a refresher as well. But that's not needed very often because we do take considerable care to give a nice presentation about how the best way to use this equipment truly is. And a lot of our customers, if you read our reviews, for instance, will speak to that. We'll speak to the fact that the technicians take that time at the back end of that installation to do that.
For sure. Well said. Couldn't have said it better myself. All right. Thank you, Cassie, for recording, our outreach team for being behind the scenes, and Aaron for sharing your expertise. Appreciate it all.
You bet.
Enjoy the day, everyone.